Hello, and welcome to PsychMeds. I'm Dr. Raj, and I'm a consultant psychiatrist and assistant professor in psychosis studies at the University of Cambridge. Today, we're talking about clozapine, which is honestly, I only reach for when nothing else has worked. But for some people, it's life-changing. So, what is clozapine? It's an antipsychotic, but not just any antipsychotic. It's mainly used for what we call treatment-resistant schizophrenia. That's about 1 in 3 people with schizophrenia, actually. These are folks who've tried at least 2 other antipsychotics, including one of the newer ones, and things just haven't worked out, or maybe the side effects were just too much. Clozapine is also used for psychosis in Parkinson's disease, especially when other treatments have failed. I'll share a quick story. Obviously, I'm changing details for privacy. So I had a patient who'd been in and out of hospital for years, tried every antipsychotic under the sun, and nothing really touched his symptoms. He was isolated, couldn't hold a job. Relationships were just not happening. We started clozapine, and it wasn't overnight, but after a few months, he was back at home, reconnecting with family, even started volunteering. It's not a miracle cure, but for some, it's the thing that finally works. So, how does clozapine actually work? I mean, the science is a bit complicated, but basically, it's thought that clozapine interacts with certain brain receptors, which helps reduce psychotic experiences like hearing voices or having false beliefs. I always say it's like turning down the volume on a radio that's blasting static. Now, you might wonder, why not just start with clozapine if it's so effective? The thing is, it comes with some pretty serious risks, so we save it for when other options have failed. Because of the side effects, when commencing clozapine, we start at a very low dose, usually just 12.5 milligram, and then you slowly increase it, sometimes by 25 or 50 milligram a day, until you get to the right dose. This is called titration. Most people end up somewhere between 200 and 450 milligram a day, but it can vary. During that initial few days of starting clozapine, we often need to take the patient's blood pressure and pulse several times a day, which means some people may have to be admitted into the hospital or come into a day unit. In Cambridge, we have started a new virtual ward system where the patient can be monitored from their homes, making it safe and easy to be commenced on clozapine. Now, this is really important, blood monitoring. I can't stress this enough. Clozapine can lower your white blood cell count, especially a type called neutrophils. If those drop too much, you're at risk for infections, and well, that can get serious. The risk is highest in the first 18 weeks, but honestly, you need monitoring for as long as you're on the medication. So before you start, you get a blood test. Then it's weekly blood tests for 18 weeks, then every 2 weeks, and after a year, just once a month. Only 2 or 3 mils of blood each time, so not much, but it's crucial. If you miss a test, you can't get your medication. No blood, no drug, that's the rule. And, the Clozapine Patient Monitoring Service in the UK helps keep track of all this. They use a traffic light system. Green means all good, amber means keep an eye, and red means stop the medication and get checked straight away. And if you ever get side effects or even just feel a bit off, it's important to report it. The faster we know, the safer we can keep you. I always tell my patients, don't wait. If something feels wrong, let us know. All right, let's get into side effects and some practical advice. Clozapine, like all medications, has side effects. Some are common, like drowsiness, dizziness, or increased saliva. But there are some serious ones too. Seizures, changes in heart rhythm, and as I mentioned, problems with white blood cells. One thing I see a lot is constipation, and honestly, it can get quite severe. If you notice any change in your bowel habits, especially if you're not going for a few days, tell your doctor straight away. Sometimes we need to add another medication just to help with that. Now, about lifestyle. Alcohol, smoking, and caffeine. Alcohol can make you extra drowsy, so it's best avoided. Smoking is a bit tricky. If you suddenly stop or start smoking, it can change the level of clozapine in your blood. Same with caffeine, actually. So if you're thinking of changing your habits, talk to your team first. And of course, always check with your doctor before starting any new medication, even herbal stuff. Some drugs can interact with clozapine, and recreational drugs like cannabis or ecstasy can make things worse. For women, a quick word on pregnancy and breastfeeding. It's not really known if clozapine is safe in pregnancy, so if you're planning a baby or think you might be pregnant, let your doctor know straight away. And breastfeeding, clozapine can pass into breast milk, so it's not recommended. Also, sometimes if you have been on other antipsychotics that can affect your periods, when you are commenced on clozapine, your periods may return to normal. So contraception is something to discuss. I'll share another story. There was a patient who started clozapine and within a few days began feeling palpitations. It was a bit worrying, but because we were monitoring closely, we picked it up quickly and added another medication to help. The key thing is early reporting and sticking to the monitoring routine really does keep you safe. So that's clozapine in a nutshell. It's not for everyone, but for those who need it, it can make a huge difference. If you're on clozapine or caring for someone who is, remember, regular blood tests, report any side effects, and keep in touch with your team. Thanks for listening to Psych Meds. I'll be back soon with more on other medications. So until then, take care of yourselves and each other.